Treatment of hypertonicity using NMES in your TheraTouch EX4 or CX4 combo unit. In this approach, we're going to utilize the symmetrical biphasic waveform, and the treatment approach will be utilizing NMES to the antagonist to the hypertonic muscle. The mechanism of action in this case is a reciprocal inhibition of the hypertonic muscle through activation of the antagonist muscle. The clinical example in this case is hypertonicity in the biceps of a patient that is status post-stroke. Electrodes will be placed on the triceps to facilitate the weak inhibited antagonist muscle and cause relaxation in the hypertonic biceps. A key note on dosing of your intensity. Increase the intensity to a submaximal motor level that promotes slow and controlled elbow extension. First, you'll select electrotherapy, manual operation, biphasic, symmetrical biphasic, and then select the appropriate channel, in this case channel 1, and you want to set your frequency to 25 pulses per second. You want to now set the phase duration to 200 microseconds, and you want the on-off cycle time to be a 10-second on and 30-second off. Well, you see there's a default here on the screen, so we can simply just select that option. Now we're going to start a treatment with the protocol. The protocol in question is already up on the screen, so all I'm going to do here is select the amplitude button on the screen and highlight it. Now I'm going to increase the intensity to that desired level, and we really want to start to see the elbow and the lower arm start to initiate into that extension. There we go, so you start to visibly see that, and we're going to go ahead and start the therapy at this time. One note on electrode placement is I've placed the 2 electrodes on the muscle belly of the tricep, as you see here. I'm going to go back down into the resting position, and we want to again encourage the patient to try to promote and move their arm into extension as much as possible. You can also encourage the patient and work with them on more functional activities that puts the arm into extension.